Hello, my name is Dane Cruz, and I am the Regional Council Manager for Birth to Five Illinois, Region 34, covering Lake County. Thank you for watching Region 34's Early Childhood Regional Needs Assessment Virtual Report. This recorded session will provide an overview of findings from the Birth to Five Illinois Region 34 Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you would like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to the language you want. Some Birth to Five Illinois regions partner with existing collaborations to complete the regional needs assessment. Region 34 partnered with iGrow Lake County through the Lake County Health Department, who facilitated the community-based planning effort in Lake County to develop the Action Council that continues to support and expand upon the work already started in our region. Along with the Regional Office of Education, iGrow Lake County works to plan, provide, and promote a comprehensive and collaborative system that identifies, coordinates, and facilitates equitable access to early education and community services designed to help all children, prenatal through age 5, and their families reach their full potential. We thank them for their partnership and continued support as we work together to improve outcomes for children and families throughout our region. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversations that funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices boundaries but operate independently. Birth to Five Illinois regional boundaries align with school districts instead of strictly following county lines, which can be a challenge for gathering and interpreting data because many early childhood services are provided by or tied to school districts. Region 34 is located in the northeast corner of Illinois and shares boundaries with Wisconsin to the north, Lake Michigan to the east, McHenry County to the west, and Cook County to the south. The largest cities in Lake County are Waukegan, Mundelein, Gurnee, Highland Park. Each city offers a unique blend of culture and history, making Lake County a vibrant and dynamic place to live. We respectfully acknowledge that Region 34 is the ancestral homelands of the Kickapoo, Peoria, and Potawatomi nations. The land is also home to many other nations, including Miami, Ho Chunk, and the Sioux. We recognize the longstanding significance of these lands as part of indigenous peoples past, present, and future. Joining me in the Region 34 office is Maria Pisano, our Family and Community Engagement Specialist, and our Administrative Support, Painty Johnny. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in a local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to Five Illinois was created to harness family and caregiver voices in the early childhood education and care, and serve as a bridge between the communities and policymakers so family, caregiver, and professional experiences can guide the decision made to expand or enhance services across the state. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high quality early childhood services for all children and families in Illinois. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. We have three main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts a child's success, we will work to dismantle barriers that have limited access to high quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state levels. Birth to Five Illinois will use community driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and or expanded services are created to meet the community's needs.
Critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback and quantitative data from the Illinois Early Childhood Access Map or ICAM and the Illinois Network Child Care and Research and Referral Agency or NCRA to help contextualize the data at a local level. The councils meet twice a month in a virtual, in-person, or hybrid meetings. The family councils are comprised of parents, caregivers from a wide variety of family types, single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more, and prioritize the voice of those who have not been involved in the type of work before. We want to highlight those who have been involved in our Region 34 Family Council over the past years and thank them for sharing their experience with early childhood system. Fernando Aceves, Luisa Alfaro, Marta Campos, Ana de la Luz, Elena Gitasulina, Jen Johnson, Katia Lezama, Jocelyn Martinez, Brittany Niels, Kaylee Peters, Laura Rosales, Maria Salazar.
Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each Action Council reserved two seats for parents and caregivers to ensure family voices were included in every decision. Action Council members were invited to bring additional aggregated data on programs and services provided by their agency or organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 34 Action Council members, and they are Judy Armstrong, John Ashworth, Joan Badley, Cheryl Caesar, Maria Colungo, Jennifer Cordova, Jamie DiCarlo, Melissa Ferguson, Rosa Herrera, Bobby Hendon, Arnita Hodge, Nicole Johnson, Dr. Michael Carner, Lauren McCurdle, Jessica Medina, Janie Mitzker, Triana Monroe, Anani Moy, Tashia Nix, Dylan Oloth, Martina Roca, Lupe Rodriguez, Carrie Stokes, and Natalie Udston. Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of the Early Childhood Regional Needs Assessment. Council members developed the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of the Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share the report's findings. The following slides highlighted some data that was discussed by council members and provided insights into the early childhood education and care landscape in our region. Region 34 is mostly white, but has a percentage of racial diversity ranging from 32% Hispanic, 8% Asian, and 7% Black or African American. In 2020, 95% of the 258,769 families reported that English is their primary language, with a small percentage of households reporting that they are a limited English speaking household that speaks Spanish, 3%, or another primary language such as Mandarin, Hindu, Hebrew, Ukrainian, Tagalog, French, Arabic, Russian, Korean, Portuguese, Slovak languages, Punjabi, and Cantonese. Part of the conversation with council members were around priority populations, defined by the Illinois Early Learning Council as groups that have been historically underserved by early childhood education and care programs. In Region 34, the priority populations include children living in families in poverty or deep poverty, children of teen parents, children experiencing homelessness, children with welfare involvement, children of immigrant and undocumented families, and children being raised by a relative. While the data on children and families from priority population is limited, there are a few things to note about Region 34. According to the 2020 census, 25% of the children ages birth to 5 lived at or below 200% of the federal poverty level, meaning that many of them were eligible for a number of state-funded early childhood programs. Additionally, according to the information provided, as many as 64 of the kindergartens are experiencing homelessness and receive services through school-based McKinney-Vento programming. Across the region, there were 727 children receiving early intervention services and 714 children receiving an individual education plan and preschool for all. Additional information about priority populations was gathered through surveys, interviews, and focus groups and is included throughout our final Early Childhood Regional Needs Assessment report. Community collaborations are an important part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. There were 3 early childhood collaborations identified in Region 34. The Kindergarten Readiness Committee that is housed in the Round Lake Area School District, the Early Childhood Community Coalition of Lake County, and the Lake County Local Interagency Council located within Lake County's Early Intervention Program in the Lake County Health Department and Community Health Center. The Kindergarten Readiness Committee brings providers, nonprofits, and governmental agencies together to support each other's events and to avoid duplication of efforts. The committee has memorandum of understandings with Head Start, Round Lake Park District, Family Focus, and the Lake County Health Department to ensure referrals are made in a timely manner and acted upon as needed. For the past 4 years, the Kindergarten Readiness Committee has hosted the Lake County Early Childhood Education Summit to bring local early childhood stakeholders together in one place to share, learn from each other, and to collaborate. The Early Childhood Community Coalition of Lake County is working to support the child care facilities in Lake County. Survey data collected by Birth to 5 Illinois from local child care facilities revealed that attracting and retaining employees in DCFS licensure are the 2 biggest hurdles. The Lake County Region of Office is working to connect child care agencies and other entities that serve young children to schools and other support services that may result in a better readiness skill in school. The ECEC of Lake County is making headway in understanding the issues that child care agencies face and is in the process of developing a comprehensive plan to meet the needs of families in the region. The local interagency council is working to identify children under the age of 3 who might have some type of developmental delay or disability. As those children are identified through developmental screenings and or eligible diagnosis, early intervention services can begin as soon as possible. In 2020, 727 children received early intervention services. More information on the local collaboration and the work they're doing can be found in the regional needs assessment. Region 34 is home to a variety of early childhood education and care programs and providers, all servicing children based on the licensing, funding, and staffing requirements. But access to early childhood programs and services is not equitable for all of the region's families. Waitlists at child care centers and the availability of child care in our region is significant barriers for families and caregivers. As one parent has stated, all of the good child care programs here in Lake County are full or have a waiting list. Families and caregivers reported that they were highly reliant on grandparents and other family members to provide child care for their children. Some parents have had to quit their jobs, turn down career advancements due to the lack of available childcare, and cited that the cost of care is the reason that they haven't used it. There is a program that families can apply to through the Illinois Department of Human Services, or IDHS, called the Child Care Assistance Program, or CCAP. This program provides family with limited access to financial resources and access to quality, affordable childcare while allowing caregivers to continue working and or completing their education. All families are required to cost share on a sliding scale based on family size and income. However, not all providers will accept CCAP due to the delayed payments, and not all families want to complete the application, which is lengthy and can be difficult to complete. There are publicly funded preschool options available in the region, such as Early Head Start, Preschool for All, and the Preschool for All expansion program. However, not all programs are full day, nor do all programs provide transportation to and from the program, leaving many families who qualify for public funding preschool choosing not to enroll them in a publicly funded program. Additionally, there are not enough spots for families to enroll their child in care across the programs in the region, leaving some families with very limited options for childcare. Through community meetings, focus groups, interviews, and surveys, families in the region reiterated the urgent need for more affordable childcare and preschool options, staffed with providers and teachers that are well paid, supported, and who will want to continue working the early childhood long term. Similar to other regions in the state, Region 34 is experiencing a staff and teacher shortage, preventing programs from operating at full capacity or expanding to meet community needs. Staff turnover is a big contributor to the workforce shortage, and it remains a concern among community members in Region 34. There are many short-term caregivers who are interning to receive a degree or working long enough to gain experience and then leaving childcare centers for better financial opportunities. One community member noted that they have seen some turnover in childcare staff at the center where their children attend, but the turnover is mostly from students working at the childcare center until they can obtain a college degree, and others are using the position as a temporary stopgap until they can move on to another job. This is especially true for children in rural areas, many of whom do not attend a program until kindergarten. In more rural areas of the region, many parents and caregivers are utilizing a family member or friend for their childcare needs. This means if a family member or friend is not available to provide childcare, parents and caregivers are unable to work outside the home or have to take off during times when a family member or friend is not available to care for their children. Others have been forced to patch together care for their child, with some time covered by a friend, family member, or enrollment in a part-time child care program. Community and council members identify several strengths of the early childhood system in Region 34. For the sake of time, I would only share a few. Family voice is prioritized as evidenced by the Birth to Five Illinois Action and Family Councils. There are additional opportunities for ongoing education, including the YWCA Metropolitan Chicago, College of Lake County, Illinois Gateway Registry, and Erickson Institute, There is a strong partnership between the Regional Office of Education, iGrow Lake County, and Birth to Five, Illinois. And Region 34 has a wide range of early childhood education and care program options, including center-based, home-based, half-day programs, full-day programs, licensed childcare, and family childcare centers. Based on the community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so they can better understand the needs of families in the region and share the recommendations with them so they can see how to best meet those needs. There are a few recommendations made, but more can be found in the regional needs assessment. Recommendation number one: provide specialized programs and services that cater to the unique needs of children, such as therapy services, personalized learning plans, and inclusive classrooms. Offer more full day options and summer programs that include additional supports and services. Recommendation number two: increase childcare slots across all publicly funded program options, including Early Head Start, Prevention Initiative, Early Intervention, Preschool for All, and Preschool for All expansion. Recommendation number three: increase childcare slots across all childcare centers and home-based program options, including licensed childcare centers, licensed exempt childcare centers, and family childcare centers. This summer, we will be out in the community talking to more families, providers, and stakeholders about the experiences with early childhood education and care. And we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth5il.com/councils or click the link in the description to get involved. Interest forms will close later this summer, with council meetings fully resuming in August. I want to thank our state partners for their support and thank you for watching. We encourage you to stay in touch with us by visiting our regional page at www.birth5il.com/region 34, joining our Facebook group, or reaching out to me via email at dcruz@birth5il.com. Links to our pages along with my email address are available in the description below. Thank you for your time, and we look forward to connecting with you soon.